Okay, we're having our our afterthoughts, after action report, trying to figure out what just happened, kind of idea. And these ladies have been awesome and really helping to break in and pioneer a new area in which we can be relevant for helping people. And for me, this weekend has been one in which I've experienced something I heard might happen, is that be able to do something that was much more significant and substantive to people, for people, than ever imagined. And that includes my whole career of dentistry, in which I struggled so hard to be cutting edge on all the issues that are truly important to people in their health, not just what people want, not just what insurance pays, but the actual substantive, meaningful basis for health. Inclusion, oral health, hygiene, state-of-the-art restorations, and cosmetic or aesthetic work, which gets people pretty excited. But there's nothing that has been more potent in terms of having an opportunity to remove a layer of stress and pain and oppression that people carry with them. And today we got a taste of it, what it can be. And both of these ladies have been fantastic patients and teammates to help the co-discovery process of how we actually do all that, learn it and do it in one weekend. And so I've been training for a while, but it has been not live patients in this area with neurotoxins, dermal fillers, but then mostly the TMJ, the myofascial pain, myofascial pain, and dealing with those consequences. And there's been a lot of sharing going on between these two ladies about how they're feeling. There's very dramatic after effects, which are been surprising to us all. And it's all good, but we have Donna and Christy. And I wonder, Donna, are you willing to share some of your experience?
Yeah, absolutely. It's been an educational weekend for sure. But today was really unbelievable as far as just releasing pain to the point where I had an emotional reaction. Totally surprised me. And I feel like I have been, for the last 15 years, struggling with constant headaches, constant migraines, trying everything. And I feel like we finally stumbled on something that's huge. Yeah. So I think that's where my tears came from. So I might start crying again. Because I just feel like something has been released that's just been, years. So, and today was just the beginning. So, first time I felt something that's made a difference. And I have had treatments for my migraines. I have tried everything over the years. I had steroid injections in my neck. I had Botox in my head, chiropractic, massage, all of those things. And it wasn't until today that I just really felt an amazing difference.
I might add that she's been seeing neurologists for a long time that have used those modalities. So the best that medicine has been able to offer her is not come close to what she's experienced already today. And better days are coming just as a consequence of this initial treatment. And
it being so specific to what I needed. You feeling each muscle, carefully determining where every spot was a trigger. Whereas all my neurologists have just done cookie cutter, follow the chart. There was nothing specialized towards my issues. So that was huge.
Mm-hmm.
Yeah.
And I have to thank the people and instructors at the AAFE, American Academy of Facial Aesthetics, for that, because it's their curriculum, their plan. They've roadmapped the way for us. And I just, as I said earlier, it's very exciting to me. I'm still kind of in shock as to what significance this holds and what value it has for people, and what a rewarding thing it is as a clinician. And Christy, we want to hear a word from you.
I'm already getting emotional, but I'm a hygienist and I've worked 19 years and I love my job, but it's really difficult to suffer every week with the pain. And to think that I would have to end my career to relieve that saddens me enough to where it's, I just push through it. I just suffer and take Motrin and medicines that I don't like to take because I don't want it to harm my organs, and I just take those weekly, multiple headaches weekly, massaging and rubbing and heat packs and, just none of it ever really gets to the source to take care of it. And Dr. Singer being the doctor and the person who really found how to take that away, of course, means a lot to me because I've worked for him. And I just would love to see him offer this to people and other patients who feel like nobody can actually hit those areas. What they're doing isn't really as effective because they're not able to target the specific muscle groups where all of it triggers, and that's emotional for me, and I just can't help but to cry. I'm sorry, but it does bring tears because it's hope, it's happiness, it's relief, and I just hope it's something that we can offer other people.
And I also want to add that I have for 20 years been doing my very best to help to manage Christy's pain and troubles. And I've used everything I could find through not just medical sources, but dental. I'm an advocate of occlusion, getting that right. How many mouth occlusal guards have we made? And they're absolutely perfect. And she still finds that she clenches on them. I mean, the guards that we have made are they're beyond any sort of criticism. They're flawless. And the refinement I've done to her occlusion has been flawless, and yet it doesn't remain stable. She actually has orthopedic changes from all the musculature exerting forces on her teeth and the whole system. And it's been exasperating for me because I thought that if I were able to perfect everything for her and stay on top of each and every little issue over these last 19 years, that her problems would go away. And they did all but that. Some of it is stress that comes from the occupation, being elevated all the time. So we didn't just do Botox for facial and that sort of work. We also did trigger points. And that's a pretty engaging process in which I'm using a needle to tear up the muscles that are in spasm. And we use some anesthetic, we use some neurotoxin to help make it long lasting. We even have other options for the future with PDO threads. But we'll see how it goes. In 2 weeks, we get to reevaluate everything and see what more can become of it. But I'm just impressed and feel very, very satisfied that I made the commitment to come in this course financially, time-wise, that discovering what can be is so, so wonderful. So, thank you, ladies. Thank you both.
Thank you. Thank you.
You're welcome. Now we have to get home safe.
Yeah.
Everybody's so relaxed
Yeah.
now.